Are you lying awake at 3 a.m. Googling, what if something goes wrong during birth? Feeling absolutely terrified about labor and completely unprepared for what's coming? You've been told to just trust the process and this is normal. Your body knows what to do. But that's not enough when you're facing the unknown, right? What if in just 5 days you could go from anxious to fearless, from feeling powerless to completely in control, from dreading birth to actually being excited about it? I'm Trish, labor nurse mama, and after 16 years as a high-risk L&D nurse, helping deliver thousands of babies, I know exactly how to flip your biggest birth fears into unshakable confidence. In my free 5 days to a fear-free birth experience, you'll go from the fear of the unknown to completely understanding, from feeling powerless to staying in control, from terrified of the pain to confident in your ability, from worried about trauma to having the real prevention tools, and from having no voice to knowing hospital insider secrets. Join me September 29th through October 3rd, completely free. Register now at labornursemama.com/fearless. Your body was made for this baby. Let me show you how to believe it. Hello, everyone, and welcome back to the Birth Experience. Today, I am chatting with Dr. K, and we're going to be talking all things PCOS. And I am fumbling saying that right now, just so you guys know, but I am super excited to talk about this because this is near and dear to me. So I'm going to go ahead and let Dr. K introduce herself. Welcome and hello. I'm so glad you're here.
Well, thank you so much for this opportunity. I am Dr. K. I am a reproductive endocrinologist and an infertility specialist. That's kind of like we're the people who specialize in everything PCOS. And it is kind of dear to our hearts. Generally, everyone probably who does what I do have extensive training and learning on PCOS. And we see a lot of patients with PCOS. I'll get to it when we discuss more and why.
Okay.
And I'm happy that finally we have a month dedicated, that there's an awareness dedicated for women who have this condition. Because believe it or not, most people don't have the diagnosis or they don't even know they have it until very late in life. And some of them might never, ever have it. So that's why I want to discuss about this.
Well, and so I actually said this is near and dear to me because it's so insane. I have 7 children. I've given birth 6 times. I had all 4 of my boys really young. Like I had my first at 17 and I had all 4 by the time I was 26. And then I had my number 5 when I was 32 and number 7, I adopted one, number 7 when I was 42. And I had a lot of losses between number 5 and number 7. And come to find out, not only I also have factor 5 and I call it the MF or MTHFR.
Yeah,
and I also have PCOS. And my doctor told me that the reason, and I'm interested to hear your opinion on this, the reason I didn't have trouble when I was younger is because I was young. I was so young when I got pregnant.
Yeah.
But I definitely have it. I don't have all the symptoms, which that's what I'm interested in hearing from you.
Yeah.
And we'll get back to me more as we dive deeper into the conversation.
Yeah.
But I would love for you to talk to women because not everybody has the exact same symptoms, right?
No. Well, first of all, in your case, I mean, you had 5 pregnancies, over the course of a very short period of time. So you spend most of time being pregnant. So it was really probably harder for you to gauge what your cycles were like. Did you even have who knows? Like there's a lot of pregnancy
it's kind
and
of
breastfeeding.
Funny.
And that timeline is like, you don't have any cycles. So, and you have newborn babies. So you don't have time to process any of this, right?
No.
So, I mean, but most of the time, and also you started very young. So here's the thing. Most of the time, PCO patients, it's a syndrome, right? What is PCOS? It's polycystic ovarian syndrome. And even from the name, I don't like it because the name does not tell anyone anything about the condition. But first of all, people say, so I have cysts? Because some people have ovarian cysts, but believe it or not, PCO patients, they don't have ovarian cysts. It's a misnomer. I mean, it's just like a crazy name for a condition. And also it's a syndrome. So it presents in different ways. So
which is
most
why I
people,
had it different.
Yeah,
Yeah.
in everybody, the presentation is different,
Mhm.
but it exists. And it exists from the beginning of time. So I always say, like, this is one of those conditions we cannot blame McDonald's on or fast food on or not. No, this is not one
Yeah.
of those things. I mean, one of the first, I mean, in medicine, that's what we do, right? It's very easy for us, like, oh, yeah, it's just type 2 diabetes. It probably because you're not eating the right foods and probably you're not exercising enough. And it would just kind of brush it off, like it make it like some kind of modern age thing. And if you feel like if we were, 2,000 years ago, it didn't exist. But one of the first books written about women is from ancient Greek, like that's, our Western medicine, refers to a sort of woman. They call it, like, a chapter is called Conditions Peculiar to Woman. And he describes these women in Mediterranean, of course, in Greece at the time. And then these women he describes as, okay, they bleed less because he's a gynecologist. Because, like, if every woman bleeds once a month, these women bleed a lot less or sometimes never. And they have male presentation in certain areas. And he describes it as like being more like hair around the chin area and also being heavier than their peers. It's very interesting, but it's dead on. And this is like BC. This is before Christ. Like, this is before anything we know in modern medicine has ever come.
But females existed. So
the females existed and females
Yeah.
with this condition existed back in that day. It's such an eye-opening experience for me. At least that was what drawn me into this condition back in the day. And this was before medical school for me. I was very interested in sciences and research. I was like, I have to know about this.
Yeah.
And at the time, now this is my past, not ancient times, but feels like ancient times. Early 2000s, I started with actually in LA at Cedars-Sinai doing some research on polycystic ovarian syndrome with amazing group of researchers. And I was not even in medical school. I was just a researcher. And I was fascinated. At the time, we didn't know, but we knew there was an association between this syndrome, not having cycles, having a little bit of excess, what we call the androgen, male steroids, right? Like we think like women have estrogen and men have testosterone. Well, we both have both. Men have estrogen, men have testosterone. They have more testosterone than we do. And then on the other hand, we have a little bit more estrogen and less testosterone. We have it both. But in PCO, women have higher androgen levels for the most part than their peers. They can. And that gives them this whole hair issue or acne. Or sometimes even to the extent male pattern baldness, right? I mean, some people can present with this. And the other piece is because they have these excess androgens, their cycles are not regular. All right, so that's that piece. And then the other piece with the PCO is it all starts, at the time we didn't know, but it all starts with insulin resistance.
Right.
So this impacts their future and their pregnancies, because I think part of what we want to discuss here, like how does this PCO impact women when they want to get pregnant? And God forbid they do get pregnant, does that mean their pregnancies are going to be a little impacted by it? And it's all yes, yes, yes. The answer is yes, yes, yes. And that's why it's so important that people know if they have this condition or not. So, and then the other piece, like, how do you diagnose it? Why should a woman suspect it? And who is she going to go to? And how is this going to get diagnosed? This is one of these conditions. The reason it doesn't get diagnosed as often as it should is because it's got some kind of a complicated way of diagnosing. It's a syndrome. So you have to have certain number of presentations out of 3. The easiest way that we know to diagnose it is, okay, we suspected, let's ask you a couple of questions. So when patients come to me, it's like, oh, I think I might have PCOS, or somebody told me I might have PCOS. And it's like, okay, how many cycles do you have in a year? Because normally we ask them, do you have regular cycles? Well, I think it's a dumb question, because a woman knows her own cycles. And of course, your own cycle is going to be regular to you, right? That's what you experience. If I have 8 cycles a year, I have 8 cycles a year, and that's my normal. But that's not normal to me. That's not regular to a physician trying to diagnose you with PCOS. So what I usually ask my patients, like, how many cycles do you have in a year? right? Is it
Okay.
12? Is it 10? Or is it 4 or 5? Right? So when patients say like, I have 0, I was okay, let's discuss some more.
Yeah.
Or they say like, well, yeah, I don't care. Like I go through like 4 months, 5 months during summer. I have no periods. It's like, okay, let's talk about that. Let's figure out what's
Okay.
going on. So that's number one, irregular cycles. By irregular, anything that's more than 35 days is pretty irregular. All
Okay.
right. And the second piece is with the cycles, if they can figure out is like, well, do you have symptoms? Because most women out there will tell you, it's like, or their husbands or their partners will tell them, it's like, yeah, in 2 or 3 days, you're going to have a period. Because
Yeah.
they have some symptoms. They crave chocolate, they
Yeah.
crave certain foods, or
They're
they're
cranky.
miserable,
Yeah.
or they're just angry
Yeah.
at the
Yeah.
world, and their children will tell them if they have a child or two. So,
Yeah.
or friends, like you can tell these things. Those are the women who ovulate, because if you don't ovulate, you don't have those symptoms,
I
right?
really am
You should have
thinking my doctor
ovulated.
misdiagnosed me
You think
because
so?
because I have all of that. I'm honestly, as you're talking,
Yeah,
thinking the reason I was so, because after I had my last
yeah,
son, my periods have been regular,
right.
like less than, because they used to be more than 40 days. And
Okay.
but that's literally the only sign I had. But now I'm just wondering if it's just because I was getting pregnant and nursing all the time
Yeah,
and
that
not
could be. Yeah,
polycystic,
yeah. It
because
is
I
very
don't have any
possible.
of the other things.
I know.
I do have PMS symptoms
Yeah,
for
exactly. So
sure.
if you're ovulating with PMS symptoms, most likely you don't have PCOS, because
I'm
that is a
thinking I
major
don't.
criteria.
Yeah.
Irregular ovulation. So the problem is like, these unfortunately, PCO patients will bleed or start bleeding, not because they ovulated, because it's been 2, 3, 4 months. And then that lining, the uterine lining
Is shedding.
it's thickening,
Yeah.
and now it's shedding because,
Yeah.
there's no progesterone,
Yeah.
estrogen can't support it. So they start shedding. But it would literally, I mean, some of the stories like I hear from my patients, they would be walking down the street and all of a sudden it's like, okay, I'm bleeding through my pants. I'm soaking through everything I have. And it's just so embarrassing. They have to rush, and because they have no idea that it's about to happen.
Okay. So that is not me. I definitely have terrible cramping. I have
Yeah.
symptoms. I'm cranky. I'm craving. So I
Yeah.
feel like she just died. And what's interesting to me is she diagnosed that with me younger because I had cysts.
Yeah. Okay. So that's the other piece. So you can have this irregular cycles. That's number one criteria. So we're going to do 2 out of 3 in this scenario, which is almost like a puzzle, right? But this is the
Yeah.
number one. And actually, there is an androgen excess society, and their criteria says like you have to have irregular cycles and no ovulation or irregular ovulation. Because otherwise, if you have the other two, it doesn't make you a PCOS patient. I mean, truly,
Okay.
this is a not functioning properly ovary, and it's an ovarian issue. So you have to do this ovarian aspect presentation. The other 2 presentations are like you have to have one other. Is one on the ultrasound. For many reasons, people go to ultrasound. We send our patients to ultrasound, and the sonographer goes like, "Oh, you might have PCOS because I see a lot of eggs." That is true. If they see more than 12 eggs on each ovary or follicles, it might be a reason, like a criteria for diagnosis. So 12, more than 12 eggs on one side, or follicles on one side that measure a certain size. So a sonographer, some patients come to me and say like, "Oh, the sonographer told me I may have PCOS." Well, it's not for the sonographer to diagnose, number one.
Yeah.
They could definitely give you that piece. They might tell you, okay, do you meet 1 out of the 3 criteria, but please talk to your doctor is a better approach than alarming the patient, because there are a lot of patients who regularly ovulate and they have no symptoms and they happen to have a lot of eggs. That does not make a patient have this syndrome.
Okay.
Because this syndrome, when we tell patients like you have PCOS, then we have to talk to them because there's more that comes with it.
Yeah.
Diagnosing it is not it seems like challenging because it's so complex. But once we diagnose the patient, then we truly believe that she has the syndrome. Then we really need to educate them on what that means for their life, because this is a chronic condition.
Yeah.
And the third piece is some kind of evidence of this high androgens, like high testosterone or androstenedione or DHEAs. So the high androgens, what do? They give us the excess hair. And usually that's the question I ask them. Do you pluck yourself every day? Do you do waxing? Do you do laser treatments? You find yourself going there back more often than your friends? And then you say, yes. I mean, some of them shave every day. I mean, this is facial hair. This is the hair that you don't otherwise find anywhere. Or they're very shy
See, I've
during
never had
summer.
any of that.
Yeah.
I've
During
never,
summer, like these are the patients who would be embarrassed to wear like bikinis and stuff, or unless they shave every day because they have this abdominal hair. You know, the pubic hair becomes male pattern. So we call it the male pattern abdominal hair, because the woman's hair should be like more, pubic hair should be more triangular and stops at the abdomen or low abdomen. But in the PCO patients, it can be a line on their all the way to the belly button. So that's another reason. Or some hair growth around the nipples. That's very common too. It could happen. Or in some cases, again, what we call the baldness. Like they have so much androgen that they lose some of the hair around the scalp, which is very traumatizing, actually. So
I'm
these are
feeling all of this is traumatizing.
Yeah.
That's a lot to deal with.
It is.
And to feel about your self-image and all of that. And then also having a hard time getting pregnant.
Yes. Yes.
Yeah.
So usually the irregular cycles, and it starts early ages. These women, the condition starts with insulin resistance, and that happens in adolescent years. So if you have a 12, 13, 14, 15-year-old girl, pretty much their PCOS starts with this insulin resistance or those early ages. And then these are the girls we tend to see that because it's a metabolic disorder, it hasn't hit the ovaries yet, but it will. The insulin resistance makes them more metabolically challenged. So they exercise and they seem to start putting on weight. The other question I ask my patients if they see me for infertility in their 30s, it's like, what was your weight like when you were in high school? And then it's usually 10, 15, 20 pounds less than what they are today, because weight creeps up because of the insulin resistance.
I'm literally undiagnosing myself.
Well, you might not have the typical
I don't think I have it. I really don't. I don't. Yeah.
But as you can imagine, in those teenage years, they don't come see me because they have too few periods, right? No, I mean, if they spent through summer, they're
like,
summer,
yes,
like, yes, exactly. Like I have no periods this summer. And it's like, okay, they're happy. Everybody's happy when they're not having periods.
Do these girls usually start their periods later than other girls?
Yes.
Okay.
They're the ones who present like maybe 14, 15.
Yeah.
Or they have like one cycle and then they don't have another one for, a year. Right.
So that was me.
And the system
was me.
Yeah. Yeah.
But then I got pregnant.
Yeah, exactly. So I think it will be really hard to diagnose you for your previous years because of the number of pregnancies you have and the number of naturally occurring ovulatory cycles you had. Yeah. Because we had a good explanation. Either you were pregnant or you were breastfeeding.
Yeah, which was pretty much all of the 90s.
Oh, yeah. Yeah.
I always joke I didn't buy diapers 1 year of the 90s. Because I had so many kids. So I could have it. It's hard. Yeah. Interesting. Because I did start late.
Over time, you have less eggs, so they produce less androgens, and then probably the syndrome, resolved itself over time. That's very possible too.
Okay. So she might have been right and I'm wrong. I'm not. Yeah.
She might, but it's going to be very hard. But so usually we don't see these young girls at that early age for that problem, but we do see them for hair growth because that's, that needs to be, and those are the ones who just, pluck, wax, laser, whatever, like they're seen by their dermatologist. But those are if you think back now, you're 30 and then that was your teenage years, it's probably, you might have the condition.
So is it better for these girls to see you younger?
Well, I think so, because then we can help them, right? They can
That's
tell
what I'm
them,
wondering.
Like, this is happening because of insulin resistance. And the best way to correct insulin resistance is a lifestyle intervention. Please continue exercising and change your diet. Lower the carbs, and of course, telling this to a 17-year-old at the prime of their French fry eating years, that's not going to bode well. But at least they will know, right?
But if you tell them, will that help them with the late in life syndromes, like the male pattern baldness and the pubic hair? Because if you tell a teenage girl, listen, lay off the McDonald's fries, because otherwise you're going to go bald and have male type pubic hair, they might listen, right?
Yes. They might. Yes.
That is speaking their
Yes.
language.
Or if you're going to tell them, okay, we can control this hair growth, what's called hirsutism, hair growth by adjusting things in your lifestyle, I think they will be very receptive. And the other piece is, if they're sexually active, they might be thinking about some kind of birth contraception anyway, and we'll go like, how about some birth control pills?
Yeah.
Right? Because that also reduces, like, that's a treatment for hirsutism. So if they have, and also, control their hormonal balance.
Right.
And give them the regular cycles they might need. So there are options that we can control if they have issues that early on. But also they will understand that, okay, I have this condition. I don't want to do anything with that because nothing is bothering me now, which is fine. That's kind of the teenage years, right? Nothing bad ever happens to us.
Yeah.
But at one point it's like, I have this condition. Maybe I want to do something about that later on. And these are the things that I might expect that could happen to me. And these are the ways that I can change that from happening. Because these women also are very high risk for developing gestational diabetes and type 2 diabetes after their pregnancies. Because of the insulin resistance. And that's another discussion I usually have with them. It's like, okay, everything is fine with you because you're young, you're healthy, and your body compensates for everything. So you can have 100 grams of carbs and your body will secrete the insulin that you need. But at one point, it's going to come, our bodies will just, as we get older, you'll be more prone to any of these things. Or I sometimes warn the ones like, okay, you might not have the weight gain issue. You might not have any of these things. You're the lean PCO, which we have, but you still have PCOS. And, after you stop the birth control pills and you're trying to get pregnant, you might have some challenges. You might find yourself not ovulating because all your friends will tell you like, okay, on the 14th of the month, I'm ovulating, or on the 20th of every month, I'm ovulating. And then that's when I have intercourse to get pregnant. And you'll be like, none of that is happening to me because I don't have any periods for 6 months. So those are the things we can discuss when they're teenagers. But let's say most of the patients who come to me, they come to me because they stopped the birth control pill and they wait. And nothing is happening.
Nothing's happening.
Or they bleed once. They say, like, okay, that's my period, and then they plan for having intercourse and there's no period again for 40 days or 50 days. And it's like, I don't know when I'm ovulating. Or they wear the Oura ring, or they try to chart things. It's like, I don't know when I'm ovulating. And it's just so bizarre because nobody else relates to that, right? Because everybody else are on them. They go like, what do you mean you're not ovulating? I know exactly when I'm ovulating because my app tells me when I'm ovulating. Yeah. And they're a little confused, rightfully so, because everything that we have to help us, even on the digital like stuff that we're wearing or looking at our watches or apps, they're for people who ovulate. When you don't have regular cycles, then everybody's a little confused. And they said, like, but I always have regular cycles. Well, you were on birth control. You didn't have really ovulatory cycles. We were like, the hormones were making you bleed. And when the hormones are gone, and now you're waiting for your ovulation, that may or may not happen. So now the other thing is like they say, like, am I not ovulating at all? But most PCO women actually do ovulate on and off at one point, but the predictability is gone. So, I mean, today, just literally right before in our conversation now, I had a patient who says like, well, we're having intercourse every other day, so we don't miss this. She has PCO. I was like, oh my God, like you can only do this for so long. I mean, she's young and healthy but I mean, this is not a lifestyle.
Yeah, that's not sustainable.
Like, no. Yeah. And then, of course, let's talk about what happens. They could get pregnant, but miscarriage rates could be a little higher for PCO women. And that's a very challenging topic because they say like, why? I'm only 31 years old. Why are my eggs not giving me healthy babies? Well, I said, like, you have the same number of healthy eggs like a 31-year-old, but we have more eggs to choose from every month. So when you're trying on your own, statistically speaking, your odds of having a unhealthy baby, which would lead to a miscarriage, is higher. It's harder for them to understand, but I just want PCO women to understand also when they do get pregnant spontaneously, they're at a higher risk for miscarriages. And that's another reason why I see them. They said like, okay, it took me a while before we got pregnant because I wasn't having regular cycles, but we did get pregnant.
And then you had a loss.
You had a loss, which is also devastating.
So let's get to the good news.
Yes.
Let's get to what can we do, because this topic so far is really heavy.
I know. It is heavy. It comes with its downs. But I think that's why it's like I want people to understand having irregular cycles is not normal. And if something is bothering women about their menstruation, I mean, for us, for gynecologists, their menstrual cycles is one of a woman's vital signs. It's
Yeah.
as important as their blood pressure. And oh my goodness, like, okay,
So
that's
we can't worry about our hair as much because her hair is really bad,
I
right?
know. It's like growing out of everywhere.
Everybody knows Tula is always with me. So, it's just part of the program. Anyway, sorry. So,
Okay, so
yeah,
for PCO patients, does it matter at what age they come to me? I'm super hopeful. Well, now we have so much information on PCOS, number one.
yeah,
Number two, my field is wealth of like experience and medical evidence that will help them, that will support
yeah.
my statement that we will most likely get most PCO patients pregnant with a healthy baby in no time. And that
I
is the
love that.
bottom line. That
Yeah.
is really the hope
That's
out
the
there. But
good
they will
news
need
we've
our
been
help.
waiting for, ladies. So I know you told me that you're in San Francisco, which I
Yes.
love San Francisco. I did a lot of my travel career as a travel nurse in the Bay Area. So
That's true. Yes.
yeah.
That's
And
awesome.
so for these women who are in the Bay Area, obviously they can come to you. So we'll
Yes.
tell them how to find you. But do you help people out from, like, do people come from other areas to you, or do you have
Yes.
resources?
Yes,
Okay.
yes. Do people come to us from, well, first of all, as you can tell, the way I speak, I'm not
Yeah.
the native Bay Area person. I'm international. So I have a lot of
Which is
international
most of the Bay
patients.
Area. Yeah.
Which is the Bay Area, right?
Yeah.
And HRC is also, we're the largest infertility center in California, mostly in Southern California. Anybody thinks about egg freezing, IVF, any type of reproductive health, immediately mind goes to HRC because we're huge.
Yeah.
But we're the Bay Area in San Francisco, we just recently started. So we're very, very excited to bring HRC to the Bay Area. But we do see a lot of international patients. I see patients nationwide who come to the Bay Area because it's a nice place
Yeah.
to get a treatment. And also we serve the international population through HRC too. We do the largest third-party reproduction, but that's kind of our specialty, dealing
Okay.
with patients who are not necessarily local. We make it
Okay.
very easy for them, and their patient experience will be seamless and excellent.
I love
And
it.
that we take pride in that. That is for me kind of why I exist, is about the patient experience. Because as we talk, there are a lot of things goes into how, diagnosing a patient, treating a patient, and sometimes can be stressful. Do I have it? Don't I have it? Who's my doctors? We just want to make sure that they come and their journey is going to be pleasant. And
Yeah.
PCO patients is definitely have no reason to worry about anything because the science is there and our help to them is there, and it comes in different tiers or levels that they're comfortable with, because it could
Right.
be as easy as, okay, let's change your lifestyle. How about we start with that, right? Or they say like, I've done that, I'm in the next step. It's like, how about we start with some pills and we try to do some insemination. There are levels and levels and levels of treatment for PCOS, depending on how little they want to do or how they want to implement science and technology, and they want to just go for it. And it's like, if somebody says like, okay, I've been dealing with this for my entire life, I know what it means, and I don't want to take baby steps, like I'm here for a baby
They're
next
ready to
month.
go.
It's like, okay,
Yeah.
there we go. Let's
Yeah.
I mean, the PCO patient is the patient that I can promise a baby within a couple of months with no hesitation, because we know how to find the good eggs. We know how to get
That
them
is a
pregnant.
good
We know how
promise.
them keep them healthy. Yeah, those are
Yeah.
big promises. But again, that's why it's very hopeful. I mean, if your diagnosis is PCO and PCO only, and that's kind of what gets you between you and your baby, we're here to help. That's
I love that.
definitely, yeah, we have solutions.
And your website's really easy. So tell everyone your website.
Having babies.
Havingbabies.com, because that's what you want. Yeah.
And that's what we want.
I love it.
And having babies. And actually, like, this was back, I mean, we've been around. The HRC have been around for like 35 years. And sometimes people say like, I don't want to have a baby now, but at one point you want a baby, maybe.
Yeah.
So I think it should be more like having babies whenever you want should be the website.
But it's really a great website.
Banking.
Yeah. I mean, it's a great website. So I also do business coaching for women, a lot of women in the birth, baby space. And I tell them all the time, make your website, make your username super clear.
Yeah.
And that is a really clear website name.
Yeah. I know.
It's
but
very
what about
easy to
babies?
remember. Yeah, I love it. So I love this. I try to keep my episodes less than 30 minutes because I
Oh,
know my moms, they don't like to listen long. But I want you guys to really hear this. Like, this is so promising, and I love it that you're saying, because I feel like that's not always what they hear,
true.
right? You
True.
know?
It's like kind of like these diagnoses comes like, first of all, if you diagnose somebody with a condition that they're somehow familiar with and it's all negative, I think that stops there. They don't listen to anything else. I think
Yeah.
if any patient listening to this, they might wonder if they have PCOS or not, or they just heard that they have PCOS. You will have no issues getting the right treatment, and the right treatment will get them to their healthy babies. I think that's what they need to hear,
I
because they
love
have
that.
nothing but eggs. The
Yeah.
most women, what they suffer in infertility or in my world is like they don't have enough eggs. We can't find the
Right.
good eggs. These women, they have nothing but eggs. If
Yeah.
somebody comes to me at the age of 40, even in their 40s, and they want to have a baby, I know I can get a PCO woman pregnant because they have nothing but eggs.
Nice.
We have
Okay.
eggs to
Yeah.
look for good babies.
Yeah.
So it's fine.
Yay. So that is the good news when it comes to this, because the
Yes.
rest of it, like having the male pattern baldness, having the
Yeah.
other problems, has been a lot for them, a lot
Yes.
for them to have to handle.
Yeah. And over time, that gets better. Because
Okay.
inevitably, just like every other woman, our eggs kind of die on us. They disappear, they go
Right.
away. But that's what happens with PCO women, is like that excess number of eggs as they age will go away. And then
Yeah.
the hormonal balance will just regulate itself. And some of the
Okay.
women actually find themselves having regular periods after a while, excess androgens not being a problem as much. So over time, everything gets better.
Okay. And do they tend to go through perimenopause and menopause later in life because of all this?
Yes. Yes.
Okay.
I mean, like usually we do what our parents do, moms do, not parents, moms
Yeah.
do, or siblings do. That when it comes to menopausal years. And usually if a woman has PCO, probably her mom has it too.
Okay.
And those are good predictors of when they're going to go into menopause.
Okay.
But theirs is usually later. They don't have early menopause issues usually.
Okay.
Yeah.
Okay. All right. Well, thank you so much for coming today, Kay. I'm sorry
Of
that I
course.
surprised you with video, but you look great.
I know, that's
And
okay.
we did it. And Tula made an appearance, so it was fun. But I'm so glad you're here, and especially for this month. So this
Of
is
course.
perfect. Yeah.
It is an important month. We didn't always have this for our PCO women. I'm so happy that we're aware that we're just able to talk about this
Yeah.
condition.
All right. Well, thank you so much for coming today. And you guys all heard that you can find Dr. K on havingbabies.com. And for those of you guys who are here who potentially have PCOS and have felt like exasperated and frustrated, I hope this has given you some hope. So we're going to celebrate those babies with you guys. As always, make sure you guys hit subscribe, leave a review, tell us what you love, tell us if you have any questions, and I'll see you again next week. Bye for now. Hey, birth workers, lactation consultants, coaches, course creators, or service providers whose best fan ever, ideal client, is a mom, and you're creating content but not making sales, listen up. Here's what most of you are missing. Moms do not buy like business owners. So if you're following all the business coaches and Instagram gurus who only know how to sell to other entrepreneurs, that's exactly why you're getting crickets. In my sold out offer challenge, I'm teaching you exactly how to create content that converts moms into paying clients, not followers, clients, sales. This took me from posting and praying to consistent sales. I'm going to share my exact framework and how I built a 7-figure business selling a course to moms. The challenge is $33. VIP is $147 with daily live coaching after every training. I am only running this a few times a year, and this might be the last one for 2025. Go to trishwarecoaching.com/SOO right now. Stop posting for vanity metrics and start posting for sales.